I'm Dr. David Draughn. I practice in two locations. One is in Charlotte, North Carolina, in the south part of town in the Valentine area, and the other is just west of there in Gastonia, North Carolina. So I did my training as a general surgeon and practiced general vascular and thoracic surgery for about 20 years. And then I took a liking to some of the new vein treatments that were coming out and started getting involved with those and just got deeper and deeper involved in it and decided to change careers completely and went from being a board certified general surgeon to going through all the board processes of a second career in venous and lymphatic medicine, as it's now called. So we started doing veins and got busier and busier and just had a whole new career after, age 50. And it's kind of nice to start over and do something fun, and doesn't take 24 hours a day of your life to do it. You're not in the OR 6 and 8 hours at a time. Although I love general surgery and I love the operating room, now I get to have a life for the second half of my career. And it's a new field, a new specialty that hardly anybody knows anything about. And venous disease affects about 50% of women by age 50. Well, if you can help that many people with simple, easy procedures and have a good life, what else could you ask for? We've been watching CVR for 5 or 6 years, and I guess they've been watching us, and they seem to be getting bigger and bigger and doing better and better, and more people joining. And if they're doing that well and that many people are on board, then several of my colleagues joined, and I talked to them, and they were having a good experience. And I'm getting older. I'm 62 now, and I'd like to retire by 65-ish. So if I can learn a few new things at the end and teach the new people coming in a few new things that I know, or a few old things that I know, as I find my way out, then I thought this would be a great transition. Basically, it's as simple as the patient comes before the paperwork. I don't treat the paper. I don't treat the test. I don't treat the results. I don't treat the whatever. I treat the patient. And so whatever's best for the patient is what we do. And of course, I want them to know the risk and the benefits of what we're going to do before we do it. I don't want them to say, well, old Doc so-and-so said he's going to do an exploratory on me and open me up and he found something in there, but I don't know what he did. Well, I don't want any of that. I want you to know what's wrong with you, why it's wrong, what we can do, what it's going to do to you if we do it, and what's going to happen if we don't do it. And then you get to make the decision. So I'm the captain of the boat, but you're the navigator. And where you want to go, I'll get you there. I think that I have honed the skills of a surgeon for 40 to 50 years now. I've always wanted to be a surgeon ever since I first thought about being a medical person back in the 7th grade. So I've always, been in the operating room or doing procedures, and I've worked on that skill. I don't think I'm the only one that can do it. I don't think I'm the only one that's good at it. I think something that's a little more different about me as a surgeon, I think most surgeons are maybe more talented with their hands and less talented with their personality and their communication skills. And that doesn't mean they're not good surgeons, but I think that surgeons in general are known for being short and sweet and abrupt, and we're going to cut here. Is that okay? Fine, let's go. Well, I just don't see that as okay. I want you to know what's wrong, why it's wrong, and what I can do about it. And everything that I do has a price to pay. And it may be pain, and it may be recovery. And you need to know all of that up front and be prepared to do it. And of course, in today's world, there are financial consequences. And I don't want anybody going bankrupt trying to do medical things that they don't have to have done. So I feel like I have a little more of a family physician attitude with the skilled hands of a senior experienced surgeon. Well, I want my patients to know about me is that I'm going to take care of them like I would take care of my mother, my sister, or my wife. Um, you come first, and what you need is what we're going to get. You do an operation on a patient and you get paid, but they don't get better. That's no better than striking out. And so the goal is for the patient to be better. And if you make the patient better, then that's a home run. If you get paid, okay, that's gravy on the side. Likewise, if you need an operation and you can't afford it and you can't get it anywhere else in any other way, then I'm going to take care of you and we're going to help you get what you need. I never thought going into medical school that I wanted to be the person that helps people. I was just fascinated with the anatomy and the physiology and the miracle of life, and I thought I was going to be taught the miracles of life. And when I got through with it, what I learned was that the miracle of life is that you've been given the knowledge to help somebody that can't help themselves and that may be in dire straits and may be dying. You've been given the privilege and the gift of being able to help them. And so that is the secret of life, so to speak.